Introducing the electronic dental scoring system. This is a digital way to chart your patient's mouth, helping your practice go paperless. e-VDS Plus is designed to make dentistry more systematic and encourages vets and nurses to fully examine and chart the oral cavity. It allows you to input your patient's clinical findings on digital charts, which provides thorough documentation and history for each patient. Getting started is simple. Go to Settings, My Clinic, and enter your practice details, your name, address, contact number, and email address. You can add your company's logo, and you can also input the names of your examiners. This is especially important for larger practices. You can then select them by default for the scoring. It is important to place a semicolon between the names. Once this information is saved, it will be visible on your patient's scoring charts. Then you can select a new client, insert their last name, their first name, and their email address. Save this and then input your patient's species, their date of birth, and their microchip number is optional. Client and patient details can be easily edited at a later stage. You can check your patient's scoring history by selecting the Update button. Here you can see your patient's previous visit history. You can search for a client by using the search box. Add part of their first name or surname to search. Select the scoring mode before you begin. e-VDS Plus is available for free for a 30-day trial. The mode must be selected before you start scoring. It cannot be switched during or after. Now your tooth scoring can begin. Firstly, I'd recommend going to Options. This gives you 3 options. You can select Puppy or Kitten to give you primary dentition. The multiple selection tool means that you can mark several teeth at the same time. An example of this would be if you had several teeth missing in a quadrant. It'll speed up the scoring process. The practical format is for tooth resorption. This tool allows us to select between an academical and practical classification of tooth resorption. The academical classification allows us to choose from 7 types of resorption and 5 stages. The practical format reduces the options down to inflammatory or non-inflammatory and exposed to the oral cavity or not exposed to the oral cavity. Once we have selected our options, you can then select your first tooth to score. Missing teeth and treatments are marked as full tooth markings, and clinical findings are marked as tooth marginal markings. There is a notes section to add any additional findings. The periodontal probing depth is measured at 4 points, which provides a thorough evaluation providing figures for the mesial, the buccal, the distal and lingual palatal probing depths. There is an additional option to mark a treatment plan. If your patient requires extensive multiple treatments and all your clinical findings and treatments are marked, then you can highlight the tooth that needs future work in a later procedure by clicking the Planned button. For example, with this chart, 2/4 needs restoration treatment. If we click the Plan button, then view the chart, we can explain to our owner our plans for this tooth. Occlusion can be selected, which can be described more accurately if necessary in the selection Orthodontics. The general section is used for complete mouth scoring for calculus and stomatitis scoring in a cat. There is a text box to fill in the location of any oral masses noted. The general notes box can be used for discharge advice and revisit appointments. At the end of the scoring, click Validate. This will save the exam. The exam can also be edited if necessary by clicking the Edit button and duplicating the score. There are tutorials available to help support and guide you through your scoring process. The tutorials will help with clinical findings, diagnosis and treatment options. Direct links in the scoring programme link to the corresponding chapter and are available by using the I button. The photos are brilliant to demonstrate your clinical findings to the client. Exporting your patient's results is really easy. You have 3 options, either to download, email, or to print. You can either download the results to your desktop as a PDF file and then insert them into your practice software, send the results by email, or lastly, print the results. You can also upload your patient's X-rays, clinical documents, or add any photos of your patient's mouth by attaching them to their file. The data tool is a great way to perform a simple evaluation of clinical findings and treatments performed on your patients within a selected time frame. For example, if I wanted to look at the general number of patients this month, I select the period, the time frame, and then apply. This information can help you budget material and consumables based on your clinical cases. Thank you for listening to this tutorial. I hope that you have found it helpful. Remember that you can try e-VDS Plus for free for 30 days by registering at scoring.evds.vet.